Dr. Mills?
What?
Are you Dr. Donald Mills?
Yes, I am.
You've been served.
I must admit that my days rarely begin with this much excitement. To tell you the truth, I don't see the logic behind scaring people to death to deliver a summons. They probably lose more defendants to heart attacks. I suppose I always knew that the possibility was there, but I never thought it would ever happen to me. And Mrs. Clark, of all people. I've been treating her for 7 or 8 years. In fact, the last time I saw her, she was so grateful that I finished her bridge before her daughter's wedding that she gave me an invitation. I knew I should have gone to that wedding. This is all very peculiar. Oh, I don't know why I'm even concerned. This is ridiculous. There must be some kind of mistake. On my 12th birthday, my grandfather shared some immortal words of wisdom with me. He said that the best things in life were free, and for everything else, I'd have to wait. Since I had no idea what he meant, I remained as impatient as I'd always been. On my 16th birthday, I finally figured it out. He bought me a car. Since then, one of my most admired traits has been patience. Well, that is until now. 5 months, 24 days, and 4 hours since I got that miserable summons. The attorney my insurance company assigned to me is finally prepared to talk with me. I've probably remembered in detail every procedure I have ever performed. Then again, I seem to be forgetting other things, like my kids' names, my mother's phone number.
Thanks for coming down to my office, Doctor. We have a lot of ground to cover today.
I want you to know that I've been practicing for over 22 years and I've never had a major complaint from anyone. Why, I'm even treating the 3rd generation of some families.
Doctor, I want you to relax. I realize this is your first lawsuit, so most of this is unfamiliar to you. But during the course of this litigation, you're going to have to think of me as your warrior and your shield. It's my job to fight the battles that need to be fought. That's what I'm paid for. Now, it could take a number of years for this case to unfold, and throughout this period, you're going to be questioned about your judgment and your ability to perform. So anxiety and anger are perfectly normal reactions. But remember, it's your job to be a dentist, and it's my job to worry about lawsuits, so just try to clear your mind of it.
I feel like a failure. I can't believe that someone could think that poorly of my work and...
Doctor.
I'm sorry.
Before we review the records today, I want you to answer one yes or no question. Do you feel your treatment of Mrs. Clark was proper?
I'm a good dentist, and I've never had a complaint from the Clarks. I just can't believe that she didn't give me the chance to work this out.
Is that a yes?
Guess what? Oh. Yes. Yes, I treated her properly.
That's all I wanted to know. Now, for the deposition and trial, try to remember to only answer the question asked, and no more. If the plaintiff's attorney isn't smart enough to ask the question, then he doesn't deserve to know the answer. But as for me, I need all the information you can give me. Before we go through your records, I want to give you an overview of this whole process. As you know, I've already filed an answer denying the allegations contained in the complaint. However, the actual trial won't be for quite a while, and for a period of this time, the attorneys will be occupied with motions back and forth and what's called the discovery. These are procedures for each side to find out what the other side is claiming. We'll also send them questions regarding their complaints and discover the treatment she received after leaving your office. Next, there will be depositions where you'll come into my office and testify under oath to Mrs. Clark's attorney. This testimony may be used in the courtroom if we go to trial. But above all, remember to remain calm and professional.
I suggested how we could save the tooth with the periodontal treatment, but she said she wanted to have it finished by her daughter's wedding, so the only alternative was to remove that tooth and then prepare the other teeth for the longer bridge.
But doctor, you're the trained professional. You're the dentist. You're the one who's supposed to know what's best for your patient. I mean, do you always let your patients direct their treatment away from the optimal plan?
Sir, dentistry is a service-oriented profession, so part of my job is to make sure that the patient is comfortable with the treatment. And there are always options that can be considered. I can't force anyone to take my suggestions. The patient is responsible for the ultimate decision.
But don't you feel now that presenting this option might have been inappropriate and that proceeding with this care was negligence?
No, I don't.
I want you to understand that a huge majority of the cases are either dismissed or settled out of court. Very few cases actually go to trial. But if we feel as we do now that your actions were entirely proper and they continue to want to sue you, we will try the case and defend you. But that's not something you have to concern yourself with right now.
I just can't believe that this could hang over my head for years.
It's something you'll gradually learn to deal with. Okay, I'd like to step back for a moment and see if your office records clearly and accurately reflect the treatment you gave to Mrs. Clark. We're going to start with the presumption, which is true in all the cases that I've handled, that no set of records is ever as complete as we would like it to be. In retrospect, there are always things we wished we had done or added. But the record is the record, and we have to live with it the way it is at this moment. This record will be the focus of this whole lawsuit.
In other words, I shouldn't make any changes.
Exactly. Changes should never be made in dental records. Okay, let me see your records.
Well, I've got the whole family here. Stephen, Beth, Judy.
You have the whole family together?
Yes, we always keep charts by the family.
It would be better to have separate charts. It helps reduce confusion, especially in an emergency. Do you have her x-rays?
Oh, yes, they're right here. Here's her most recent ones, and here's a complete series that I did 3 years ago.
Are these originals?
Oh, yes, we keep all originals.
That's good. When did Mrs. Clark's new dentist request her records?
Well, let's see. Copies were sent on March 28th, and we also sent a discharge statement, which I used to define where my care ends and where the next dentist should begin.
That's a good policy. I wish more dentists would send discharge statements. Do you think it was odd that the records transfer was requested?
I'm so busy, I guess I didn't give it much thought.
When did you first see this patient?
Well, almost 7 years ago.
And when did you last see her?
This year, January 20th.
When you take a new patient, what do you do in the way of medical history?
Well, I have them fill out a brief questionnaire.
Has her medical history been updated since her first visit?
Well, I don't have any notations of changes, but I always ask the patient how they've been since the last visit.
Let me pose one of the first tough questions that may come up during the deposition. With respect to the procedure you are going to perform on this patient, would an updated medical history be something a dentist would want to know?
I suppose it would. I usually use anesthetic containing epinephrine. Yeah, I probably should have checked with her again.
Do you remember her mentioning things about her medical history during the visits when you were diagnosing her dental condition?
I have some recollection that she'd had a physical and...
So we don't have a complete medical history for the past 7 years, and you have some recollection of her mentioning at least a physical, but it's not charted. Is that fair?
Well, how often would you recommend updating a medical history?
Every time you see the patient, particularly if you haven't seen the patient for a long time, and especially in advance of any surgery or other invasive work. Dentists should consult frequently with patients' physicians about health status. Things that you remember about her treatments. things that she told you but which aren't reflected in the chart are important. Unfortunately, in dental malpractice suits, what's charted becomes what happened. And if it's not there, the plaintiff's attorney will do everything possible to convince the jury that it never took place.
I see.
Now, what are these numbers?
Well, these are measurements of periodontal pockets in millimeters.
Some of those are blank.
I usually leave them blank if the measurement is below 3, which is healthy. Now, we had to remove a tooth 2 years ago because she'd had a periodontal abscess. And there's a note here by my hygienist late last year that she mentioned to the patient that the tissue around another tooth was becoming periodontally involved.
Had you discussed this periodontal condition with her?
Mrs. Clark, we seem to have another area that's becoming a periodontal problem.
Does that mean you have to take out a tooth again?
Oh, no. With appropriate periodontal surgery, the tooth could probably be saved.
Well, that sounds fine. What do we do next?
First, I'll send you to Dr. Adams for the periodontal treatment. When you're finished there, I'll construct a bridge for you.
As long as we finish by my daughter's wedding.
When is that?
6 weeks, 4 days, and 3 hours.
Oh, I'm sorry, Mrs. Clark. There's just no way that we can finish that quickly.
Well, we'll just have to wait. I'll think of something else.
Well, there are alternatives, but they're certainly not as desirable.
Like?
We would have to remove the tooth, and then I would make a bridge to fill the spaces.
Can it be done by the wedding?
Well, yes, it can, but that's...
What are we waiting for?
Mrs. Clark, you'll be losing a tooth that could be saved, and you'll end up with a bridge that'll be longer and which will require more home care.
Well, I don't care that much about the tooth. Besides, I think bridges look better than my real teeth anyway.
And now, Mrs. Clark, if Dr. Mills had clearly explained to you that the tooth could be saved and what treatment was necessary, would you have agreed with him?
Oh, yes, of course. This is my health we're talking about. If I understood what was at stake,
It's just not true. She just wanted to look good for the wedding.
Dr. Mills, will you please be seated?
No, don't ever do that. Remember, I want you to stay calm and collected, and above all, don't show any emotion, no matter what you hear. I'll address the discrepancies during cross-examination.
So, Doctor, is it fair to say that it was your recommendation to remove that tooth and make the bridge longer?
It was the end result, but it is not.
Don't do his work for him. I want you to answer only the question that he asks you. And think carefully before you do.
Would you repeat the question, please?
Is it fair to say that it was your recommendation to remove that tooth and make the bridge longer?
No, that's not true.
And now, Dr. Mills, you say that you told the patient to see a periodontist and that you wanted to save this tooth. Is that correct?
Yes.
Well, Doctor, I can't seem to find any notation in your records to that effect. Could you please guide me to that entry?
I didn't write it down.
It would have been helpful if you had noted in the chart that you did refer her to someone, but she chose not to see him. Okay, take me through your diagnosis.
Well, all I have here is a note that she needed a bridge due to the loss of a tooth 2 years ago, and that without periodontal treatment at this point, she could lose one more tooth.
Even though you can assume that any other dentist who looked at this would know what the problem was, it would be helpful if you had been more specific.
Like tooth number 9 affected by mild periodontitis, space in upper anterior area.
That's exactly what I mean. See, by charting this, there's no question later as to whether or not you were fully aware of the problem. What it really boils down to is taking the time to make detailed notes on everything. I noticed that not all the handwriting in the chart is yours. Is it your practice to chart each and every time you see the patient?
Well, the only other handwriting you see here is my hygienist, and that's for all the cleaning visits, and, well, a couple of times you've got the receptionist here when she had to make a phone call either to reschedule an appointment or to check on something. Now, we do make notations when the patients call us or when we call them.
One of the issues we're going to have to confront is whether the disease developed over a number of years and whether the chart reflects that you are checking it regularly and making notations. I see some places where the hygienist has made a notation, but you haven't. Would you have seen the patient on those dates?
I always check my patients after their recall visits. Besides being required by state law, I like to see how they're doing and if they have any questions or problems that need my attention. Now, if the hygienist has written everything accurately, I don't add to it.
What are these scratched out notes here?
Well, let's see. Oh, yeah. That was where we accidentally put her daughter's notes in her chart by mistake.
Another good reason for not keeping all the charts in one record. When you have to make an alteration, I suggest that you draw one single line through the error, write the correct information, as well as why the change was made. Because the plaintiff's attorney may think you tried to hide something. I also noticed that there are dates where nothing appears. I'm not sure how to interpret this.
Well, a couple of times she'd canceled, and we'd already had the dates written down, and, well, we just must have forgotten to write in the cancellation.
Another one of the theories of recovery that they're suing you under is the doctrine of informed consent. This basically claims that the patient wasn't properly informed of the risks and complications of the procedure. Can you tell me what you told her in terms of the risks of the procedure? And again, refer to your chart to tell me what you documented.
Everybody knows the risks involved. You're going to bleed a bit. You'll have some swelling and it'll hurt for a while. Well, there is a chance that a root tip could break off, or they could have a severe bleeding response and end up hospitalized, but dentistry is a part of treating the whole body.
There also doesn't seem to be anything in the record that clearly shows that you told Mrs. Clark the risks involved with this extraction. Did you tell Mrs. Clark the risks involved in removing this tooth?
She had a tooth removed before, so I assumed that she
Yes
knew
or no?
No, I didn't. I realize informing a patient is important, but there's even a chance that a patient could die from having an extraction. I mean, surely I don't have to tell a patient that if I take out a tooth, they might die. If I said that, I might as well close up my office right now.
There are complications that are so remote that no one would consider you responsible. But the law does impose upon you the duty to inform patients of the risks, especially the ones that are most common. Do you have a brochure which you could give to the patient that describes these risks?
I use the ADA pamphlet for patients who are having their first extraction, but Mrs. Clark had a tooth removed before, so I never thought about giving her one.
Attorneys find printed handouts particularly useful and persuasive before a jury in order to document that the patient was informed. Since the brochures are available, I'd recommend using them with all of your patients for every procedure. And just make a note in the chart as to which brochure you gave them and what questions they may have had.
To save time, can my assistant handle this?
No, you have the obligation to inform the patient yourself.
Well, there have been times when I thought about taking more notes, but I haven't because the practice is very busy and I just can't afford to take the time.
Doctor, you can't afford not to take the time.
Yeah, judging from this case, I guess you're right.
Where do you chart the type of anesthetic and the amount given?
I've never listed that. I only use one type of anesthetic.
This is something that should be faithfully recorded. Many cases I see involve mishaps with various anesthetics. Do you have any recollection, even if it's not recorded, of the patient complaining during the procedure?
Oh, doctor, I feel sort of dizzy.
Well, that's not unusual after you've been lying down for 2 hours. Why don't you just rest for a minute? Melanie, let's leave Mrs. Clark semi-reclined. Now, you can go just as soon as the dizziness goes away, okay? And Janet will set you up with your next appointment on the way out.
What I'd really like to see, if this situation presented itself again,
Oh, doctor, I feel sort of dizzy.
Well, that's not unusual after you've been lying down for a long time. Melanie, put the blood pressure cuff on her while I check her pulse.
Don't worry, Mrs. Clark. This feeling happens to a lot of people.
these are the kinds of things we like to see charted. Was the dizziness momentary? What was your evaluation? What treatment or recommendation did you make, etc.? And then a note that shows that after lying down, the patient no longer felt dizzy.
I just can't believe that we're expected to take time to put down things like the patient was dizzy for a minute. I mean, things are really getting tougher and tougher.
There's no question that it's a burden, but believe me, it isn't the kind of burden that's going to overwhelm you, especially when it becomes second nature to pick up a pen before the patient leaves. And make a note about procedures, follow-up appointments, and post-operative instructions. Do you have any special post-op procedures?
Not really. I usually say something like, if you have any discomfort, feel free to call me.
I see. Something they'll eventually ask about is your specific recollection. You'll find that by the time we get to the deposition or the trial, the case could be a few years old. Chances are, if you're like most of us, you won't remember exactly what you told the patient to do in terms of post-op instructions, like whether she could eat or drink, when she could take medication, and so on.
But I want you to follow these post-operative instructions exactly as we reviewed them, and take the medication as we discussed. By the time I get done with the paperwork, I'll be lucky if I see 4 patients a day.
By the way, do you ever make follow-up calls to your patients?
No, I just assume that if there's a problem, they'll call me. My home number's in the book.
That follow-up call is something we'd like to see, especially if there's a chance of infection or adverse reaction. It doesn't have to be done with every tooth cleaning, but it should be done with extensive operative or surgical procedures. Remember, you're in the business of providing service, and those follow-up calls tell the patient that you care.
It seems like this intensive record keeping has to be to a dental practice what brushing and flossing is to the teeth, preventive.
That's sort of catchy. Do you mind if I use that?
Do I get royalties? Even though it wasn't my money, it still bothered me that we settled out of court, but it didn't bother me nearly enough to let it drag on for years. Besides that, now that the case was settled and the check was delivered to Mrs. Clark, I could finally talk to someone about it.
Oh, here you go, Don.
Thanks, Chuck. It's really good to see you again.
Well, how can I help you?
Well, I don't really need any help. I know that you've served as an expert witness several times, and I guess I just want your opinion.
Well, I'm all ears.
I just settled my first malpractice suit.
Did you win or lose?
I'm not sure. I guess I lost, but I feel like I've won because it's finally over.
Congratulations, then. What happened? No. Don't tell me. Inadequate documentation and lack of informed consent.
How did you know that?
You're not the first, and unfortunately, you won't be the last. You know, you're probably lucky that you didn't have to go to court. See, I testified last month in a case where the dentist insisted on going to trial, even though his records had some flaws. And you know something? I really felt sorry for the poor guy. Because no matter how competent a dentist you may be, and no matter what you remember telling the patient, when you're sitting there being cross-examined without that paper trail, you're up the creek without a paddle.
I can certainly identify with how he must have felt, and I didn't even have to take the stand. I mean, here I am after 22 years in practice, and I have an attorney telling me how to keep dental records.
Oh, now, come on. Don't be so hard on yourself. Dentistry changes, just like everything else in the world. And there are only so many hours in the day for us to learn to adapt. Now, look, I know it's probably too late to help you on this case, but just for the record, continuing dental education courses can be beneficial when it comes to getting on that stand. If the jury knows, for example, that in the past couple of years you've taken 50 or 75 hours, it's going to make you that much more credible.
How do you find time for all this record keeping?
Well, I had to work longer hours at first, then I got more organized, and it became easier. But I have to be honest with you. Even the most trivial of details can win or lose a case. You never know what's important, so it's better to write down everything.
When this started, I really resented Mrs. Clark's new dentist criticizing my work as unacceptable just because I was trying to meet her schedule. But then I saw a new patient last week, and I feel that he has had improper care.
What have you done so far?
Well, I told the patient that we may have to do some treatment, but I haven't had the treatment planning consultation yet. What do you suggest?
Well, you know why he left the previous dentist?
His company transferred him.
Now, a dentist criticizing the work of other dentists has become a big problem. I mean, just because someone does something differently doesn't mean it's wrong. So first of all, I'd call the previous dentist, get his side of the story. Perhaps this is the best result he could get for the patient. Then again, perhaps the patient's home care contributed to the premature deterioration of the treatment.
Well, we have talked about better brushing and flossing.
That could be telling you something. Then after you've talked to the dentist, talk with the patient, but be careful how you present the treatment needs. See, patients hear comments differently than we do, so watch your word choices. And if you sincerely believe that the previous treatment was negligent, then educate the patient about the problem. And if necessary, work with your local peer review committee. And if you continue to see negligent treatment repeatedly coming from one office, then perhaps the state dental board should be contacted. But in all cases, work with the patient so that he or she understands that the court should be used only as a last resort.
I see. I have one other question. It's about my new office policy. As a result of this mess, I have decided that the next time I feel a procedure is necessary and the patient doesn't, I'm going to recommend that they find a new dentist.
Well, that's fine, but when you terminate a relationship, there are specific guidelines for you to follow.
More rules?
Well, I'm afraid so. First of all, you can't jeopardize the patient's health in any way. So that if you're in mid-treatment, you have to complete that treatment before asking the patient to leave the practice. Then you've got to give the patient time to find another dentist, with the understanding that you'll continue to see him for emergencies. Then, after he's located another dentist, you'll send copies of the records and other pertinent information to that dentist. Those are the critical points. Now, I'd recommend the best way to terminate a relationship is either through a registered return receipt letter or a well-documented in-office consultation.
There is one good thing to come out of all this.
Well, that's what I like to see, a positive attitude. What is it?
I have learned that keeping preventive records is a must, because even good guys get sued.